I'm Elise Pass. I am a research faculty in the Department of Mental Health, and I am the organizer of a four-part Department of Mental Health Wednesday seminar cluster. You may or may not know today we're actually in a joint session with the Department of Pop Fam and co-sponsored by the Center for Adolescent Health. You might be here and thinking there was somebody else coming, and that's true. We were going to start with Dr. Jackie Bailey from UT Austin today, who unfortunately was unable to come very last minute and sends her regrets. But this is a four-part cluster about mixed and virtual reality to promote EVP use and public health outcomes. So I'm going to do just a really quick orientation as to why we're even having this cluster before we dive into today's talk. Before I get started, I just wanted to share a listing that Dr. Phil Leaf in the department has shared in our weekly updates sent by Michelle Moffitt, but to reach all of the audience and to remind those of you who might have seen this, that there's a session tonight around youth violence prevention with the Baltimore Brothers and Baltimore Youth and Children's Fund. And so it's a virtual event. It's at 6 tonight. You can get more information about it on the bcyfund.org website. And then there's an Eventbrite for those interested and can't jot all this down. Michelle Moffitt would have the details on that, as would Phil Leaf. So why this topic? There are lots of applications. I mean, people are obviously very just excited about technology, and we continue to think about how we can integrate technology into our lives and into our fields professionally. And virtual reality really offers this unique opportunity for training, and particularly in spaces where we might want to keep those on the receiving end of what's being trained the safest, right? So we see applications of this in medicine, where we have doctor training happening that's virtual so that they can get skills without working on live people, for example. We see this in education. There's a large movement around this specific technology we'll be talking about today in pre-service teacher training. In business, it's another area where you see virtual training happening. I'm seeing more and more around how this might address implicit bias and racism, how we might train police officers, et cetera. And so it's an interesting and important topic with a really far reach, I think, into public health and public mental health. And that was why I wanted to really think about getting a cluster so that I and we all could learn more about this important topic and maybe be thinking about ways we can integrate this into our own work. The nice and important and interesting part of this is there, and we'll talk a little bit more about this in our own talk, and I think there'll be more talk about it next week. There'll be a continued theme. But, other than the fact that there's a safe space, there's also this kind of accelerated pace at which we might be able to train skills. And that's why I think it's been recognized as being something that we should be trying in many fields. And I think that the research on this is really emerging. And so as researchers, I think there's a lot of gaps that can be filled. I have a particular interest in more of the soft skills, the ways that we promote behavior change that will ultimately get people to adopt evidence-based practices. My context of interest are schools, but the talk next week won't be focused on schools at all. And so that's just kind of a little bit of a foray into why we're here and what you can expect from these talks in this cluster. As I already mentioned, the intention was to have an external speaker for today, and I'm not that. I actually work at Hopkins, but myself and my colleague, Dr. Brooke Paskewich, will be talking today. We have our other colleague, Dr. Tracy Waasdorp, who I hope is on, but she had a conflict and was going to try to come on just for a little bit. So the three of us will be talking today. I'll give a real intro on them in a moment here. I have another talk lined up for a week from now, avatar-assisted motivational interviewing training in the Alacrity Center that's focused on cardiovascular disease, smoking cessation, and obesity. And I had an all call out to students for the 23rd, and so far nobody's taken me up on that. I had planned my team to be the backup plan for that, but then today happened. So I just want to put out an all call again and say, if you are interested in this space, if you are doing research in this space, somebody doing this research in this space, please, please reach out to me. I would love to fill this space with somebody else. And I'm even open to outside the box ideas. Like, I'm not actually researching this area yet, but I'm a student and I'm really interested in this and I'd like to lead something about it. So please do take me up on that. I'd hate to see that seminar not get scheduled, but the way today worked out, it's just going to be increasingly hard for me to fill that slot. So here are our three colleagues. I already kind of introduced myself, but a little bit more as I'm an associate scientist in the department. I'm a school-based researcher and focus on prevention and promotion of positive development in behavior, social, emotional, and mental health in K through 12 schools. I also work in special education spaces within that with a specific focus on autism. And I'm one of the 2 MPIs on the study that we'll be talking about today. My colleague that is also going to be presenting with me is Brooke Paskewich. She is at CHOP. So this is a 2-site study we'll be talking about today. And so she's at the Children's Hospital at Philadelphia, and she's the director of operations for school-based bullying and social emotional learning. She's also a research scholar there with expertise in translational research. She and her team are all focused on the development, implementation, and evaluation of school-based aggression and bullying prevention programs. They are the true experts here when it comes to the bullying prevention piece to the work we're presenting today. And she has been so instrumental to so much of the work that happens up at CHOP in this space in terms of really mapping out the implementation methods to see how we can get evidence-based strategies into schools and really promoting fidelity. And so she is a co-investigator on this grant that we'll be presenting about today. Dr. Tracy Waasdorp, who I'm not sure if maybe, Brooke, if you could look to see if she's here, it's a long list.
I'm here.
You are. She turned on her camera.
Yeah, I only have a few minutes, so I just wanted to say hello.
Sorry. All right, so I'll introduce Tracy just like I did for Brooke. So Dr. Waasdorp is also at CHOP. She is similarly in the same school-based bullying and social emotional, it's such a mouthful, I'm sorry, you guys, social emotional learning space. She's a director of research there. She is also, like me, kind of a research faculty position at CHOP. Tracy and I go back a long way. Personally, we were postdocs at Hopkins together, so she's linked in our department and an alum, if you will. She brings a ton of expertise and really is a leader in the field around relational aggression and bullying, translating her child development background theory into actual prevention and intervention programming. She's been involved with a number of different trials and development of school-based intervention programs that are focused on children's social emotional learning skills and prevention of their bullying or aggressive behaviors. And she is really the brains behind that whole part of our grant that's focused on trying to help teachers. So I'm going to go ahead and launch into the meat of what we're here to talk about today. And I'm going to start by actually turning it over to Brooke.
Okay, hi everyone. I'm excited to be here. And because the mixed reality simulator that we're here to present today is a component of our intervention, the bullying classroom checkup, that's all about helping teachers detect, prevent, and intervene with bullying in their classroom, we thought we'd start off first with just a brief definition of what bullying is, just to lay the foundation for everyone. So there's 3 criteria that make a negative peer interaction bullying. And so it's an aggressive behavior that is repeated, so it happens more than once. It's intentional, so the students involved are trying to be mean or to be hurtful to another student, and it occurs within the context of a power imbalance. So one or more of the children involved in the interaction has more power than the other, whether it's through physical stature, age, strength, popularity, reputation, something like that. And involvement in bullying can really cause significant disruption in schools. And it's really quite prevalent. So 1/3 of students in grades 4 through 12 report being involved in bullying on a regular basis. And by the time students graduate high school, nearly all of them have a personal experience with bullying, whether it's as a bully themselves or a victim or a witness to it, which is what we call being a bystander. And bullying contributes to emotional harm, it causes physical injury, and it also has an impact on academic success. And even notably, even being a bystander, so you're not involved directly in the conflictual situation, you're watching it happen to your peers, even that's associated with negative outcomes, negative emotional, physical, social outcomes. So it just makes intervention with bullying, it just points to the importance of bullying intervention for teachers. Because teachers are on the front lines, as you can see. So children, especially in the, K through 12 even, spend more time in school during the week than they do at home. So they're interacting with teachers and their peers at school, even more so than their parents at times. And so it really puts teachers in a really important role to intervene with the social interactions of their students. And teachers can have a really powerful impact on their students and on the social climate of their classroom. And we know that the relationship that students and teachers have is really important in shaping student perceptions and behaviors. And when those relationships are really strong, students feel safer, they feel more supported, they're at less risk for psychosocial distress if they're involved in bullying or negative peer interactions. And having strong relationships with teachers can really buffer some academic decline that can happen if kids have negative peer interactions. So those relationships between students and teachers are really important. Teacher responses to their students' peer interactions are also really important and can impact the situation quite a lot. So if teachers underestimate the prevalence of bullying in their classroom or the impact that it can have on their students, especially the more the non-physical forms of bullying, so the gossiping, the rumors, the social exclusion that children can do, if they underestimate that and the impact that it can have, or believe that bullying is like a normal part of growing up, or kids will be kids, girls will be girls, and they think that kids can just resolve it on their own, that can actually worsen the situation and cause bullying to increase. And so what we know is, just given this important role and the impact that they can have, teachers really need support to make a difference in their children's social world. And so there are a lot of mandates out there that schools and teachers and staff have to do something related to aggression and bullying prevention, which makes a lot of sense. There's a lot of student-focused anti-bullying prevention programs out there. The good news is many of them have shown promise. The challenge is implementation is so critical for success. And so really making sure that the interventions are being implemented as intended with strong fidelity is so important for the programs to work. But oftentimes it requires a lot of staff time and staff engagement, which can really be challenging, particularly in under-resourced schools where teachers and staff have a host of other competing demands on their time. So if it's really hard for a teacher to implement something, unfortunately, the program can be less effective. Some other challenges where we can support teachers is students rarely report bullying to adults, so maybe they don't know that it's happening. Conversely, we also know teachers maybe sometimes have trouble detecting it, so they're not maybe paying attention to it as much as they could or realizing what it looks like, especially some of those non-physical forms that I was just talking about. And sometimes teachers wonder, is it their role to intervene with bullying as a teacher? And do I have time to address it in the context of trying to really get across all the important instructional lessons that they need to do? And we also know that teachers have limited training in intervention strategies, de-escalation techniques, and that makes it really hard for them to know how to handle peer difficulties, aggression, and bullying, and how to really integrate a social emotional approach to their classroom management. And all of this can be challenging in schools because if teachers aren't responding or are delayed in responding or ineffectively responding, unfortunately, bullying situations can get worse. And so this really helped the team come up with the idea of really translating a classroom management program that has existed, the CCU classroom checkup, to incorporate a bullying prevention lens called the bullying classroom checkup. And the early studies related to the bullying classroom checkup was funded by the National Institute of Justice between 2016, 2018. And qualitative results really suggested the need for a program like the BCCU for all the reasons that I just explained. But students in the study, communicated that they worried that their teacher really didn't care about their peer relationships, and they really wanted more of an emotional connection with their teacher. And teachers felt that really paying attention to students' social relationships was hard. It was hard to keep track of. They struggled to have the time, and they didn't feel like they had effective strategies to respond. And so the bullying classroom checkup was created. It was implemented with 80 teachers across 5 middle schools, and it showed promise in helping teacher practices related to bullying detection, responding. There was increased referrals to school counselors, more intervention on the part of teachers. Teachers felt that it really helped them learn effective strategies for intervention. And importantly too, they reported it as really acceptable and feasible, which, as I shared, implementation is so important. So the fact that teachers felt like this was something they could do within the context of everything else in their job was a really important finding. And so what is the BCCU? This is our conceptual model. And so what it does is it through a coaching and consultation model that uses a trauma-informed approach, it really supports teachers in incorporating a social emotional skills and practices into their classroom management strategies, and also gives them some really practical bullying prevention, detection, and intervention strategies that they can do in their classroom. It's really personalized, and it's responsive to their needs and where they are in their own development as a teacher. And so just some other key features of the innovation of the BCCU. As we mentioned, it is teacher focused, and it has a really important goal to pay attention to the implementation and how to balance helping teachers address the social interactions and bullying in their classroom, with also recognizing that there's time pressures to focus on academics and to teach those really critical, math and reading, et cetera. And so how to really acknowledge the time pressures and teach evidence-based practices that you can do quickly and in the moment, but that also send the message to the students that, this is really important. Your social interactions, your social experiences are really important for me to address, and that certain behaviors just aren't okay. It also focuses on relationship building as a key element in shaping positive youth development and behavior. And it utilizes motivational interviewing, which, as Elise said, there's a session on that next week, so we won't get into that today. But what we will get in today is it also utilizes guided practice with a mixed reality simulator, which is really, really cool. So teachers get to practice the strategies they're learning with student avatars prior to trying them out with their own students in real life. Okay, so we have an R01 from NIH, which Tracy and Elise are the MPIs on. I am very excited to be a co-investigator on the study. As Elise mentioned, it is a multi-site study. So we've got the BCCU running in Maryland and also in Philadelphia. We're each doing 16 schools over the next 4 years. As compared to the first study, we shifted the focus from middle school down to elementary school. We'll be in 3rd through 5th grade, which is a really pivotal time for intervention because bullying peaks in adolescence. So we're really giving teachers skills to intervene right as those kids are, gearing up to hopefully prevent bullying from increasing over, the next year or two when they reach middle school. The intervention, as I mentioned, well, there's 2 hours of professional development for teachers. It's kind of like a bullying 101 with some foundational knowledge information about what bullying is, and then really some practical strategies for prevention, detection, and intervention. And there's coaching, as we mentioned, and practice in the simulator. So I'm going to turn it over to Elise, and she's really going to dive into what this simulator looks like.
Okay, thank you so much, Brooke.
Mhm.
So the part that I bring to the table is coaching, expertise, motivational interviewing, and the kind of access to this Teach Live simulator. So this gets me really excited to talk about. So I could spend all day talking about coaching and the motivational interviewing piece all of itself. So there is just not time to do that. But if that's something that interests you and you get even more interested if you come to the talk next week, I'm always happy to talk about that. But as I mentioned earlier, the reason we were thinking about simulation for this particular area is that this is a space where I do lots of different coaching work with teachers, and there's some stuff that, it's just okay for them to try to practice maybe more just general classroom management strategies in their classroom as a safe space. Whereas when we're trying to talk about how do you respond to maybe some toxic language used between children with one another, and how do you really process that and respond in real life, the simulation really offers that safe space that we can't do with like through a discussion and then letting you try it in your classroom and then the coach gives more feedback. The other thing that it offers is that the teachers, like Brooke talked about, is they miss it often because there's so much aggression that can go on in a classroom that's really nuanced and very social. And it is hard to keep track of all of it. And we also know that it's in high frequency also in other places where there might not be access to the students, like in an unstructured non-classroom setting. And so we want to make sure they're able to be exposed to it in a way where it's a little easier to detect, where they can actually like get what we talk about, like building a little bit of muscle memory so that they get used to detecting it and responding to it, and also recognizing that there's a way you can do this without it totally taking them off track, which is the big fear. So we're trying to really get them that accelerated practice where they see it, each time they're in the simulator, and it's not like, oh, I came in today and there really was nothing going on, so I'm going to come back as a coach and try to see it next time, so that we know we can accelerate it that way. And we're giving them a real chance to gain some fluency with these skills that really just take time to emerge. And when we've done this in the past with middle school teachers, they shared a lot of really great feedback about their experience with the simulation. The first theme that they had shared was really that they were able to connect their own practices to student behavior, which unfortunately is sometimes challenging to make that connection. And that's an issue around buy-in. And that the simulator really highlighted that for them. They felt like it was real. They said that they felt like they really have a relationship with these 5 kids. They got to know the 5 kids because the kids, as I'll talk more about, they're stable. They really are like real kids who you can get to know. And you start to get to know their likes and their dislikes and what makes them ticks. And the teachers really liked that. One teacher actually said, I just wish this was like a video game I could play at home because I totally would. And then I get so much better at this. So it's something that they enjoyed doing. And then the other interesting thing that we didn't necessarily anticipate is it actually gave all of the teachers that got coached a shared experience that they could talk to colleagues about. Now, teachers sometimes do have those shared experiences, particularly in a middle school where they're swapping classes all day. But it might not actually be the best thing for the kids' privacy for them to be talking about those things the way they sometimes might. And so this is, again, a safer way to talk about some of the challenging things they might be faced and interact with each other and grow together. And that was not something, like I said, we didn't see that necessarily coming as much as it did, but that kind of sense of community. As I said, there's a lot of work that's done around coaching. I've done a lot of it myself. And there is a lot of promise that we can actually change, at least in school context, but certainly coaching is in lots of fields. And the research on it kind of looks different in different fields. And in education, it's really an emerging field with a lot more empirical support that teacher use of evidence-based practices does change when they're coached. Some of the gaps, however, are that we don't see sustained use of skills necessarily, say from like the year that they got the coaching to the next school year. Most studies actually aren't even looking at that, to be honest. Like a recent meta-analysis that looked at like 80 studies, it was like 1/10 of them that had actually even looked at sustained outcomes. And the findings are like mixed. So some are finding that it's sustained and some are not. And so that again tells you like, well, we've got to make sure the practice part is what gets attention. So the coaching historically is helpful in getting people to recognize an area for growth and getting them to to be motivated to do that and to try some basic skills. But a lot of the practice in coaching models falls on the teacher then they go back to the classroom and they're supposed to just practice in real life. And maybe the coaches following up, our models certainly have that built in. But again, it's a hard, that's it. It's really like a live practice. So with the BCCU, we said, well, we've got to get real. We got to make sure they're actually practicing these skills. We've got to make sure they can actually get feedback and keep growing. And so that's where that simulator became so essential to us in our minds of like, we need that time that's dedicated to practice in a safe space, where there can be ongoing feedback to make sure that we get the kind of impact we're looking for and that it's sustained. So that's the goal of our R01, to see if we can get there. So what is the simulator? So we call it the simulator. We're working with a specific company that I'll talk more about in a moment, but the simulator is just a classroom of 5 student avatars. There they are pictured on the screen. I alluded to this. So this was actually developed as a tool at the University of Central Florida for training service, pre-service teachers. So they actually embed it in their own training of teachers at UCF. And they work, the last time I knew a count, I'll have to get an updated count. The last time I knew a count, there were about 80 pre-service university-based programs around the country that were using this program called Teach Live. When we enter into the simulator, and I think as most pre-service programs do, we provide coaching to the teachers during the session. So they can go into the simulator, which is just a room with a screen with their classroom, and they get a chance to practice, they get a chance to reflect and get some coaching, and then they try again, and then they can get more coaching again after they've gone out of the quote simulator. And so this was developed by Lisa Deeker, Michael Hines, and Charles Hughes at UCF. And Lisa in particular is somebody we've been in direct contact with over the years about this platform, about the future of the platform, and she's got some pretty interesting ideas about where this can go as well. Maybe you'll have some too. And so it's been a really instrumental partnership to be able to work with this Teach Live classroom. And instead of just continuing to say more about it, I'm actually just going to share a video for about 3 minutes so that you can get a sense of what this really is.
Well, if you want to take that technique, yeah, give it a try. Pick any number you want.
I'm picking 0 because I think 0, that's the best.
Oh, 0 is a good one. Actually, I like 0. Why'd you pick 0?
Just because
Sorry about that.
I like multiplying by 0 because it's super easy.
Okay, so let's go ahead and do those calculations. What calculations do you have then, Cindy? If you stick a 0
well,
in there.
because 0 works because, like, it'd be like, 0 times 4 is 0, right? And then plus 1 is just 1, and then that doesn't equal 3, so boom. It's wrong.
Exactly. Excellent. Okay.
Hey guys, I'm so glad you're back from lunch. I hope it was delicious. We are going to jump right into science. So I need you all to get all the materials that we're going to need. As you know, it's on the board here like it is every day. So if there's anything that you have on your desk that we won't need for science, please go ahead and put that away. Who can tell me what matter is? Yes, Ed. Thank you so much for raising your hand.
Well, matters, that's like when you have molecules that go together. It can be anything. It can, be a table or, anything. It's solid or liquid or gas.
Oh, thank you.
It could be air, it's everything.
Sean, so I remember you saying
Sorry about that.
you had a story to tell us. Do you want to go ahead with that?
So we're talking about matters changing states, and it's so cool because our freezer broke, and my mom was really upset. And but I was saying, Mom, it's kind of cool because we're watching like the ice turning to liquid, so it's changing matter. And she laughed so hard. She's like, "You are just such a science brain."
Oh, Sean, that's a wonderful story. I'm so glad you were talking about what we learned in class to your mom. That's great.
Well, we're all done, and as you know, the objective of your lesson was to go in with a STEM activity and engage the students. And so we have this Teach Ours video coding feedback tool, and I'd like you to take a look at the behaviors that we coded, the high leverage practices that we were looking at. So we were looking at questioning, wait time, and feedback. And as you can see, you had 3 instances of specific feedback.
All right, I'm going to stop there. I'm going to try to figure out how to now get my slide to go forward. I don't know how to do that anymore. It is just because now I'm like in the YouTube space. Give me a second. Let me get out of that. There we go. Let me find. Ah, sorry
Well,
guys.
if you want
Oh, there it goes. That is the irony of me not being able to navigate the technology in the slideshow to talk to you about the technology in the simulator. So that gives you a little snippet. In that case, they're using this green room. It's a little fancier. That's in their kind of studio at Teach Live at UCF. But I wanted to give you a sense of what it feels like to kind of be in the room. Now, the cool thing about this is you just need a computer and a mic and speakers and internet, and you can get onto this from any computer. And it's funny because before the days of Zoom, that felt like really mind-breaking. Now it's like everybody's on a computer all the time with their face. So now you can probably imagine this if a lot more than if I had talked to you about this 3 years ago. But it's transportable in that way, right? We can schedule with them and we can be anywhere. We can be in the Philly schools and Maryland schools. We could be in our offices and we can be connected to this classroom. And like that little clip about the coaching, like we similarly, so we're in the room together with them and we're able to just talk about it in the room. And then our coaches then meet after they're in the simulator on the back end, just like you were seeing in the video. So there's programming like programmers do, and then there's mixed reality programming. So maybe you're thinking, what is mixed reality even? So virtual reality is entirely computerized, whereas mixed reality, this one, there's a part live component to it, which is an interesting difference from other virtual reality platforms like the one that you'll see next week and like other ones. I mean, maybe you're thinking virtual reality and you're thinking goggles, and those exist too. Actually, Tracy and maybe also Brooke have had experience with like a goggles-based bullying prevention program for kids in schools. There's a few of them in the bullying space. I know Dorothy Esplage has done some work in that space as well. And so, but when we're in the space of mixed reality and there's a live human component, it is to help get the most out of what we need from the students responding. So we are able to kind of program, if you will, the exact types of behaviors that represent bullying to make sure it's accurately represented and with face validity, right? The types of things that the teachers are really seeing in their classrooms. We also are needing to program so that it's consistent and to fidelity, right, during that process. So anytime you go in, they have their own fidelity process already. The student is the student. Sean, the little guy talking about matter, he's super excited about school and he will talk a mile a minute and he will tell you everything about his life, and he does that in any session, and that's a thing that the teachers learn to work around. CJ, you might have noticed, had her phone out, in this case, she was engaged, but she was not totally engaged. She can be very disengaged. And so that's a consistent thing that they've established within their own system. But when we come in with our flair on this is that we're focusing on bullying, and we need to make sure that there is bullying, say, in every session, but it might look different depending on where teachers are. We've had to make levels that I'll talk a little bit more about and matrices around what that looks like to ensure there's fidelity. And so we're building on what already exists in terms of they have their own kind of well-established definitions and levels for intensity, but it's really been historically only focused on just more generic classroom management skills that are extremely important and part of what we're trying to achieve as well, and building out what it looks like where we're incorporating social emotional skills into the way that teachers need to be responding, not just simple behavior management, that we're making sure that there's a predictable way in which our bullying emerges over the course of sessions. So this is an example, this is like what we've had to map out. So they have a 5-level system that we've had to add to indicate what are the things we want to see in terms of disruptive behavior, peer conflict, student responses, and what are our goals at these different levels, so that we can say, okay, this is session 1 with this teacher. And basically, everybody's going to start in the level 1 to 2, and then they might progress through our 3 sessions. And so we need to be able to communicate very clearly. In this session, session 3, we're at a level 4 for this teacher, whereas this session with this other teacher, we're still at a level 2, depending on their own growth trajectory. And so there is that real human element that is there, and the coach is the one that's kind of turning that dial up or down. And so this is our intensity levels. Just to draw your attention to a few little things in there, when you see the plus, say, for example, under disruptive behavior level 3, it's the things above it plus the thing that's been indicated. So it's building, right? So you might or may not notice that in all instances, we have some level of conflict beginning with level 2 up. Level 1 is really one we're never really going to totally use other than the first few minutes, just so that they don't get scared out of the room. And that's because usually it's just for their pre-service people, not for their in-service teachers. And then in terms of the student responding, we want to make sure that teachers aren't overly intimidated and it can go slow. So at first it's kind of like just using a skill, like a redirection, will get the student to back off. But where we're moving through those higher levels with the teacher, now we're expecting better quality out of their response. So if a student is to engage in a form of aggression, like they've verbally mocked another child in the class, at first, if they just redirect it kind of in a very like business way, like we're focused on math right now, I need you to get your math book out, the kid will back off because we're new to the simulator. But what we're really trying to get teachers to think about is a higher quality redirection that actually acknowledges what's been done, and that it's more than just a pain to the teacher that you've disrupted math. You've actually just mocked another student, and that could really hurt feelings, but not in a punitive and angry way, in an acknowledging way. Like, it feels like you guys aren't getting along that great, and I really want to talk to both of you separately after class about what's happening here. And then move on, because teachers don't have time in the moment to really sort through all that. We also know that it's not best practice to talk if there is a true bully victim situation where a child is really bullying, they have more power, there's intentionality and repeated nature to their aggression towards another child. We don't just like throw them together immediately. That can be really traumatic for the child who's been victimized by that person. The other thing we have to have is a behavioral grid of all of the different forms of aggression. So this is one of 5 that we have listed out, where we are touching on the forms that Brooke introduced with. We have relational parsed back out into exclusion and reputation damage, verbal and physical. We can't do physical in the simulator, they can't get up. And luckily they can't hit each other, but we can have physical threats. So those are the different forms. And you can see here, we've kind of taken the behavior on the far left. In the middle, we just define it. So everybody's on the same page. That's like the definitions Brooke gave you all. And then on the far right are what are lower intensity behaviors that you would do, say, at a level 2, and what are higher intensity behaviors you would do, say, at a level 4. So again, that we're really at fidelity and consistency. I am going to end there and just acknowledge that, as Brooke noted, this is, we've got 2 streams of funding that have supported this work, a developmental grant and our current R01. That the opinions that we've expressed today are our own and not those of our funders. And really thanking our teams, the University of Central Florida. And though I didn't talk a lot about it, actually the classroom checkup developed by Wendy Renke and Keith Herman, and their amazing input into that as well. So I want to open it up. I'm going to stop my share. And I would like to open it up for questions.
Yeah, I'm curious as just to the biggest barriers, and I know you address these to some extent, but if money wasn't an option, what would be the thing you'd want to do that maybe feels undoable right now?
Well, I hear 2 questions. The first question I'll answer on the barriers is actually scalability is a concern for me on this, and cost for the simulator. But one of the exciting things I've talked to Lisa Deeker about is she also knows this and is thinking about that. And she's been thinking about kind of more of an AI approach that would build on all of the foundations of what they've built with this mixed reality. And then that would actually make it more scalable. In terms of other barriers we face is just the logistics sometimes of scheduling. To make sure, because there's a human component to this, you're scheduling with other human beings with real calendars. And that again relates to scalability as well, but it's just how to get teachers who are already so tight on time. I think that Ideally, this is an area that we'd be doing a better job also in pre-service. And I think always when we're training people in service on something that is a major kind of challenge or in their context, and this is not teacher specific, that it's a barrier to have people that have kind of made it far into their career without some of the essential understandings of like these key components Brooke was pointing out, like relationship building is a key foundation to connecting with youth and engaging them and keeping them in schools. This goes far beyond our issues with bullying, right? Like this is actually an enormous societal challenge that we're having with engagement. And then the strategies to do that, but then also like in the bigger picture too, like de-escalation of behaviors and the way in which we are connecting with youth. So I think that these are some of our specific challenges that some of which I think would generalize outside of this context and some that don't. I hope I answered that question. We can come back to that. Jamila, I'll go ahead and have you ask your question next.
Hi, I guess my question is kind of a heavy one, but how have you looked at like cultural differences in different regions of America, and even just thinking like maybe the teacher's a different culture than the students, and how that can affect interpreting what is bullying versus maybe this is just a cultural aspect of how the kids interact?
Yeah, this is, and I'll let Brooke chime in about this as well. I can't say we've gotten very far in this. I think generally speaking, the underpinning of everything that we have to do in education and health and public health and every field in America, I think, is really dealing with the issue of culture and the disconnect between our practitioners and the people that they're serving, and that understanding, right? And so I do struggle with this a lot because some of the other work that I've worked in, spaces I've worked in with educators in particular, is really around like more equitable practices and making sure that we are engaging all students and not the ones that maybe look the most like the teacher or the closest to the background, and addressing that piece is not something we're explicitly doing in our strategies. There's an equity focus that's kind of driving through this, but your point about like cultural judgment, essentially, like do they actually understand their students enough to understand if the peers are, that they're not making judgment calls that aggression is occurring when the peers don't actually feel that that's what's happening. What I will say is, generally speaking, the data suggests the opposite problem. The data suggests that the students are overwhelmingly reporting that they're experiencing bullying, and that the teachers are saying it's far less prevalent than it actually is. So I think that's a challenge. And in some ways, Brooke had already talked about this, is like sometimes we're over normalizing what is actually harmful behavior that is interpreted as such. So I don't know, Brooke, do you have additional thoughts on that?
I think it's a really good question. And I think an important consideration when developing interventions like this is to use, and I know we do this at CHOP, and I think like the qualitative studies that informed the BCCU development, is to really take a community-based participatory like research approach to development. So like working with the key stakeholders of the people that the intervention are, is designed for and by, like really reflects the needs of that particular community. So I think that just broadly speaking is an important aspect to intervention development. And I know one that we have done up at CHOP and also at Hopkins is to really like, do a lot of qualitative data collection, working with teachers, principals, students, school counselors, parents, and really make sure that what it is we're intervening with and the strategies we're providing are relevant and responsive.
Mm-hmm.
So
right. The upside of a coaching intervention is that it is to some degree very individualized, right? And so, for example, when we talk to teachers about these are example ways you might respond to this type of situation, they are choosing the ones that resonate. I think what your point brings up is one for us to really think about, though, is just because the teacher thinks that's the right one doesn't mean it's going to resonate with the students. And that's maybe something we should be a little bit more explicit with our teachers about, like then reflecting back on like, is that working for your kids too? And not just, is that working? Do you think that that's a good fit for you? Like, will that kind of be a good fit for your kids? Will they hear what you're saying? So I think that that's a great point, and it is something that we're thinking about, but it's always good to have new thoughts and questions that stimulate that thinking. And in terms of like your point about, is this going to be okay in other parts of the country? And then thinking even more broadly, like internationally, the answer is I don't know, right? Because this was a developmental study, and we are now doing an efficacy trial that's at least now 2 sites in 2 different contexts. And and we deliberately were doing that to see, like, making sure it didn't develop something that worked like just in one community. But I can't promise that if it works in Philadelphia and in Maryland schools that we're working with, that that's going to work in Texas or California, and certainly not in other parts of the world. So, that's where we are on the arc, that I would say this is still in the very early part of the research cycle.
Yeah. The other thing, Elise, that I just thought of listening to you talk, and in reaction to this question too, the first study of the BCCU, we were really looking at teacher reported outcomes. So it was really all about teachers' perceptions of their own practices and their own perceptions and stuff like that. What we're doing with this study, which I think could get at some of what you're thinking about, which is really important, we're getting students in this study to report on their perceptions of their teachers' practices and intervention techniques, the social climate of the classroom, how teachers are dealing with behaviors. So I do think that that might be an interesting way to see our kids perceiving their teachers' behaviors as responsive and like similar to the way they're seeing it.
So even if the teachers don't get it, you're right. Our data hopefully will. And that answers one of the questions somebody asked about providing the data back. In terms of like within the coaching process itself, no, we do not provide the data back to that. They're directly like, this is you in your classroom, or have them collecting that data, but we are collecting the data, and there are going to be school level reports about what we're seeing, or site level reports. And so what we know is historically it is underreported by staff, and that's something we've had to wrap our own minds around in the developmental program, and I think we will here too, is we might actually see a higher rating of the prevalence of bullying over the course of this project if our hypothesis is correct, that there is bullying and aggression happening that teachers are missing, and then they're starting to see it, and we might see a closing of the gap between what the kids are saying and the teachers are saying. So we will have that data, just in reflection to one of the questions that was asked, and they will have that information. It is not embedded in the coaching itself. It is something that is shared with them at the PD, though, in Bullying 101, where they see kind of national statistics and research study statistics, but it's not specific to their classroom. And that same person, McCain, had another question earlier on about engaging teachers to get buy-in from those who've been in the field a long time. We haven't developed anything very specific around that. What I will say is we have completed recruitment. And if I can't, it's almost hard to say it out loud because it feels like I might curse it, but we have, during this COVID weird year, recruited successfully 4 schools in Maryland and 4 in Philadelphia, as we said we would. And our consent rates are quite high, with a number of our schools consenting 100% of our eligible sample of 3rd to 5th grade teachers. We had a couple of schools where I know one in particular at our site where we had a much lower rate, and that was more because of communication with leadership and teachers not really even knowing this was coming, and it just didn't go the way we would have hoped. And in cases where we just are able to talk to a leader who then communicates their teacher about the study, and then we communicate, we've actually seen 100% consenting. So I think it's interesting. I think teachers are aching for this. I think they know now more than ever. They're having so many challenges with behavior that the issues from longstanding teachers that might have existed before are less so, because they're like, please help me. Like, just please come and help me. So it's been really fortunate, and like I said, I'm just like, we just feel really blessed, and I think it shows that something that we're doing here resonates with teachers and even more veteran folks. Any other question? Oh, another chat. Yes, a definite silver lining of COVID. I think we have gone well over the tipping point in our society, unfortunately, for schools and mental health challenges and challenges that students and youth are facing. And I think that the adults are finally waking up and saying, like, okay, this is a problem. And so, yeah, there's definitely a movement within education to recognize this as a need.
What do you have plans, or what are your thoughts about sort of scaling up, or how this arc continues for your work?
We have some. We have had some ideas. We've thought about comparative studies that have a slightly different approach and comparing how it works. We certainly are trying to think about, is there a way that we can do this with guided practice that's kind of in this technology space, but is it a more scalable space? The question of, does it work in other places? Could this be replicated, is another question. Yeah, there's a lot of different questions that I think we have. And we have, because we're in literally, like, we haven't even closed out our first year of funding of 5 years. We haven't gotten down the road of like, well, which would we do this first, or where would we put this? We're not there yet, but I have a feeling we'll start to have those conversations a little bit more seriously, even as soon as this summer. But yeah. And welcoming thoughts. Like, if people have like, yeah, I'd love you to see you do this. I'm always interested in other perspectives.
I was just thinking about like, and again, I don't know where your funding, you may have said this, but I don't know where your funding comes from, but it seems like this is an opportunity to collaborate across specialties, and, you know, like to get buy-in from folks across the board that care about the well-being of youth and teachers, you know. So yeah, just kind of thinking about that a little bit.
Yeah, this specific grant is funded by NICHD. The earlier one was the National Institute of Justice. They had like a school safety focus for a few years on their funding. So we had gotten funding through there. It's something definitely to think about. At this point, I'll be totally honest, we're just like, we just got to make it through this year. We've got to just like recruit schools and launch an R01 during this mess that's been this COVID reopening for K through 12 schools. That's just been really bumpy. So we were just really in the weeds.
Yeah, but also like, I think an opportunity, right? Like, that's what I was trying to say. It's just like, nothing is going as planned right now, but like, but maybe that is something that can actually be helpful in thinking about how this work moves forward and gets disseminated to those people that would really benefit from this sort of innovative way of thinking.
Yeah, no, for sure. At a minimum, we're just trying to think about making sure that everything's kind of documented in a way that would allow for further dissemination, and continuing to kind of tweak that, and then at some point make it better. And then right now it's kind of a straight documentation, more like manual that I don't think anybody would actually read. And then how we kind of can make that something that would be usable and helpful to practitioners. That is definitely something I always have an eye towards. And I know like the CHOP team similarly, like she said, everything they do is like community-based participatory research and very much like engaging their practitioners. So we're all in that space thinking about that. We just haven't moved very far on that thinking yet, and certainly not on the doing. Well, we just thank you all for being here and engaging in and hearing about our work.